Most of the time what happens that I start speaking mathematics, and then there are no questions which I can answer. So YouTube Live is basically meant for question answer session, and we try to understand the remedy, its structure of remedy, the concept of remedy, the picture of remedy in my Instagram live. So it is important that in YouTube live you basically ask few questions so that I'll be able to communicate better with you. So before we have some questions, let us understand. Good afternoon, Dr. Jack. So let us understand something in homeopathy which is very very important to know. See, a lot of students come and tell me, sir, how to take rubrics from the case. Now, whenever you are trying to take rubric from the case, that means whenever you are trying to rubricate a case directly from case taking, it will become very difficult. First of all, when you're taking a case, make sure that you take the case as written in aphorism number 6, the unprejudiced observer. Just note down what the patient is telling you, maybe in his language or the language you can understand. After the case taking is done, then if you find something which something characteristic, some event of life which is suited to that case, you can always go and ask in detail from that. Don't always keep asking rubric, and the whole case is done and you apply 4 5 rubrics like element from depression, elements from suppressed anger, and likes to travel, likes to eat this. These are quite normal symptoms in a day-to-day life. Everybody, I always say, everybody goes through a stage of suppression, humiliation, mortification. That's how becomes a man. So in case taking, take the whatever the patient tells you, and then just tick mark the important points in the whole case, and then you can again revert back to the patient and then ask the case. So what happens in most of the cases where the doctors are working with me take the whole case, so I first listen the whole case, then I myself write some points which I feel I should elaborate when the patient is sitting in front of me. That's how basically I ask the question, and that's how I take my case and get the remedy. Okay. So welcome Dr. Jack, Dr. Shiv Prasad, Nitin. Okay. So most of the time in case taking, it is important to know, don't prescribe on what the patient eats and what the patient wants. The most of the patient would say, I like a spicy food and chatpata food and sweets and this. You can confirm the remedy by this, but don't enter the case just by the patient likes to eat a lot of non-veg and go and take the rubric non-veg and you are get the remedy. It is very important to understand in which phase of life the patient has come to you. That means which disease you are treating. Most of the time patient comes to me in a syphilitic form, patient of cancer, patient of high blood pressure, patient of neuropathy, the patient of CKD. So I have to find out what is syphilitic in the case. The miasm is very very important in understanding the case. Don't take the rubric anxiety or fear or sadness or timidity if the patient is presenting in case of chronic kidney disease. In that, the syphilitic symptom is very very important. Of course, a CKD patient will land up in CKD because of maybe blood pressure or diabetes and a lot of other problems. Understand what is the syphilitic symptom in that case. For example, I had a very interesting case where the patient says that because of CKD, my sense of smell has increased so much that whatever cooking in the 3 rooms, my kitchen is just 3 rooms before my room, I can smell what is cooking. I tell my mommy, don't cook non-veg today. I feel like vomiting. So this hyper state, this acuteness of smell becomes syphilitic in that case. A simple symptom of syphilitic smell also can get you the remedy, or you can enter the case to the rest. I hope you understand. A lot of people ask me, sir, how do you enter the case? How do you get the symptom? I am not searching for symptom. The symptom has to come to you. The rubric has to come to you. First of all, you must know that this type of rubric or this type of symptom is there in the mathematical and repertory. Then only you will understand, okay, I can take the symptom. For that, you have to Every day keep on reading Mater Medica and repertory. Don't try to mug up symptom, try to read symptom, my dear friends. I hope you understand that, okay? It is not a difficult thing. I always tell to my doctors who are working with me, if I can do it, everybody can do it. I've learned from my failures, I've learned from the failures and then try to, evolve. You have to be evolutionary in homeopathy, okay? So I'll take a few questions first. Uh, 24 years, married lady suffering from vitamin D deficiency, both hands, finger pain in neck, spinal cord pain, both knees, pain better by moving, hot application, worse by sitting, lying on painful side. Now, if you see in today's psychosyphilitic world, most of the patients that come to you will be suffering from vitamin D deficiency, my dear friend. If you also examine vitamin D, your vitamin D also is less. We are staying in Nagpur, and today the Nagpur temperature would be 45 degrees Celsius. So it is not the paucity of the sun, the vitamin D. The problem is we are not able to absorb vitamin D because it is easily available. Okay, in Nagpur also means so much heat, we get patient with vitamin D deficiency. So you have to find out why the vitamin D is not getting absorbed in the body. That is, the immunity of the patient is low. In this case also, your constitutional medicine will suffice for the case, is very, very important for the case, my dear friend. Are you with me? So this is important that because the body is unable to absorb. The same with cholesterol. 80% of cholesterol is made in the body, only 20% we procure from outside. So whatever diet you're taking, you're only basically deleting the 20%, right? 80% is from the body. The immunity has to be strong, the vital capacity, the vital force has to be made strong so that it fights the disease. Are you with me? Are you getting it? That is how you have to take. In your case, Dr. Shiv Prasad, Ram Prasad, sorry. There are a lot of remedies. You can think of bryonia, you can think of sulfur, you can think of rustox, you can think of arnica, you can think of calcarea carb, you can think of phosphorus, you can think these are the remedies. But for me, if I want to prescribe on this symptom, for me these symptoms are very, very common in a lot of cases. Normally the pain is better by heat. Normally the pain is better by moving because sitting will cause stiffness. So these symptoms, sometimes become very common for prescription. Maybe 10 years back I used to prescribe these remedies, but now the times have changed, and now you have to think about remedies why the patient is suffering from the deficiency. So you can think about, I'll tell you some remedies which has given me very, very good results, not indicated very frequently. First, Kaliars. Second, Merxol. Third, Plumbum Med. Fourth, Colchicum. Fifth, Lachesis. Sixth, Belladonna also. Okay, are you happy with the answer? Or if you're not, then you can always repeat the question again. Uday Singh, hi. So having extreme nerve pain leading to muscle weakness, a difficult one due to diabetic nephropathy. The question in fact has the answer with it. Treat the diabetics first, make the diabetes normal with homeopathy medicine. At least you can see in control, automatically the B12 deficiency will start feeling better. In this, I have always told you before, you can give an intercurrent remedy of vitamin B12 in potency 30 or 200, and then the patient will start feeling better. Vitamin B12 will not replace the vitamin B12 deficiency. Of course, I am telling you as an intercurrent remedy. Okay. Sir, what is the remedy of soles and heel pain aggravated in the evening? Yes, so in this case, I can say tell you some drugs which are very, very important, and this is a very important question also, that you have basically tried to tell me the modality, the evening part. Now, in these type of complaints, the modality is very, very important. Now, in your case, you are telling that it is in the evening. Now, two things are very, very important. If the patient is working in the whole day, standing and all, and he comes home and there is the pain in the soles in the evening, so that is taken as normal. But pain in the soles, burning in the soles, evening aggression, you can write few remedies which are very, very important. I'll tell you the most commonly indicated remedy last, but first I'll tell you the uncommon remedies. You can think about carboveg, you can think about lachesis, you can think about creosote, you can think about syphilinum. uncommon remedies, also Maccar. And the common remedies you can think about calcarea flow, rustox, ledampal, ruta, and belispar. So this is a complete bunch of remedies. One of the remedy will suit you. In this case, because you can't give the rest to the soul, you can't tell the patient don't go for work for 10-15 days. In this case, repetition is very important. So if you have these remedies in LM potency, please start LM potency in repetition twice a day or thrice a day, depending upon the susceptibility and the stage of disease. Okay. 50 years female, left iliac pain from last night for 3 days, tenderness at night, sciatica, colitis, slight movement, aggression, touch, warm application, give him amelioration. So if you have seen, your cases also, most of them, if you see warm, better by warm. So whenever you have better by warm, okay, you can take it as a counter irritant. But now in your case, I'll tell you one very infrequently used medicine, Dr. Meet Sudhar. There's a remedy called as thyroid stimulating hormone. Give in 30 potency, it will give you good result. This is an acute remedy and all the symptoms are covered in that. Second remedy, think about arnica. Third remedy, again a very infrequently used remedy, you can think about stelangina. And fourth remedy, think about moxol, phytolica and phosphoric acid. With loose stool, yeah. So with loose stool, I do not see that. So you can add 3 remedies. First is antim crude, second is china, and third is lycopodium. If the stools are blackish in color, then you can think about leptendra. Okay. Whenever I answer the question, if you are okay with it, just tell me something that you understood the question. So I know that the answer has been done. Otherwise, I'll add some remedies to you. Okay, my students are writing the remedies. Sir, I think extreme pain leading to muscle weakness. I have told you this answer. Okay, sir, body ache aggravated cloud in sky. Now this is again a very important thing. Sometimes the questions also have to be good. So I like to answer. Now specifically, you have told cloudy weather, my dear friend. Now whenever you write cloudy weather, few remedies are very common that comes to your mind. That is, first would be rustox or pulsatilla, sepia, rhododendron. There are some remedies which I have found very useful in practice in cloudy weather aggravation. Please write down. First is chamomilla, second is china, third is manganum, fourth, you'll be surprised, natrum carb and natrum mur also have given me results. I just remember one case where the patient, had a fracture of the tibia. The fracture was okay, and he was okay. But whenever cloudy weather comes, he had come to me after 6 months, of trauma. So whenever cloudy weather comes, he gets aggravated. So I had given the patient arnica, which is also indicated in aggravation cloudy weather, but it did not work. I gave arnica 30, 200, 1M, it did not work. I gave 1M, I gave LM potency, did not work. But my dear friend, then I gave the patient calendula, and calendula not only treated the case, calendula cured that case also, because the patient also suffered from accident, fracture, and also soft tissue injury. And calendula also has cloudy weather aggravation, my dear friend. So it's sometimes some infrequently used medicines also give good results. Of course, I also failed with arnica, then I gave calendula. I did not start with calendula. Okay, so I also make mistake, I also have failures, but how you come out from the failures, how you give the results, that is very important. Okay, you must know when to change the medicine, when to repeat the medicine, and when to think about some different medicine. Okay, I hope this is answered. Sugar is still under control. That means, see, when you're taking allopathy medicine, sugar will be under control. It is you start homeopathy medicine and start tapering the allopathy medicine, then you will start getting the results. In between, you can give intercurrent remedy, vitamin B12. Let us go. Which is the best medicine in repertory for nerve pain? All the medicines which are indicated in symptoms are the best medicine. So don't ask me that question. Okay. Rheumatic fever with neck pain and homeopathy. See, rheumatic fever is a very chronic complaint, my dear friend. So you have to give me the whole case. As far as neck pain goes, you can give any remedy for neck pain. And in homeopathy, for pain, there are few medicines which are very common and which are very indicated in every complaint. For example, like I've always told you, If there is a pain in the neck or pain in this, you can think about semicifuga, arnica, rustox, Belisper, Lacananthus, Gaultheria. These are the remedies you can think about. Okay. Body ache, cloudy weather we have done. Which is the best medicine for nerve in the repertory? I don't know. I have never prescribed on these type of symptoms, my dear friend. So don't ask me those questions which are very very specific. I don't prescribe on those nerve pains and all. You can go to the repertory or ask some doctors who is basically practicing only specifics. They might have results, but if you ask me pain in the nerves, so I would tell you there is a rubric in generalities, syphilitic lesions of nerve, and the remedies in that would be, I think, phosphorus is there, anacardium is there, aurum metallicum is there, kali iode would be there. Okay, so you can think about that. Some questions have been scrolled up, so please ask me those questions. Dr. Meer, I hope you understood that. Yeah. So I think most of the questions are answered. Let us go forward now. See, nerve pain, if there are no questions, I can, nerve pain, simple nerve pain, inflammation, neuritis, also you can think about belladonna and phosphorus and aconite and thallium, ledampal, merxol, hippursulf, gelsemium, lot of remedies. There is no remedy as called as the best remedy. All remedies are best because they are remedies and they are for us to use and treat the patients. All remedies are good. Okay, so I will not tell the best remedies. All remedies which are indicated symptomatically are the best remedies, or the remedy which gives relief to the symptom is the best remedy. Give relief to the patient is the best remedy. So I was telling you something in relation to how to understand rubrics and how to understand that. So I think this is taken care of. And now there are some patients who come to us. And they are very happy in. Okay, I'll take a question first. Sir, after root canal treatment with which homeopathy medicine should be used for much painful? Yeah, so this is again a very very interesting question, Dr. Ramprasad. You have done the treatment of tooth problem. The patient has extracted the tooth, and the patient has been taking allopathy medicine, but there is no result. In this, there are 3-4 medicines which are very 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 important, my dear friend. First are routine medicines, arnica. Second, you can think about Staphysagrina. Third, you can think about the remedies Macphos. Then you can think about remedies like Belisper. You can think about Ruta, depending on the case. One more thing I would like to add, my dear friend. Sometimes there are there is so much pain and the patient is not able to bear pain. You can give Plantago, Plantago, Plantago mother tincture to apply on the pain area, and the patient is much much better. I don't know whether I have told you one case where the patient had severe pain, not getting better by any medicines. In that case, I gave Chamomilla 1 ml, put in the cotton and apply in the painful part, and the patient was much much better with Chamomilla 1 ml. So in some cases we have to be innovative. We have to think something different out of the box. Chamomilla was indicated, but locally it worked better. So this is my experience in treating root canal. Okay, so I think my doctor is writing. I hope you understood, Dr. Ramprasad, and that was a very fantastic question. These questions are very very important because these are the cases we get day in and day out in our practice. Patient comes from the allopathy and says, I don't want to take painkillers, and then it is up to you how you manage that case. Okay, so I think the question is answered. If it's okay, then we'll go forward, my dear friend. So I was telling you something in relation to sun. Up till now, you must have heard aggression from sun headache, summer remedies. But there are patients who will come to you and say, Dr. Saab, whenever there is sun, I go out in the sun, I feel very happy. Everything is better in the sun. And you are surprised, oh my God, how this is possible? That everything is better under the sun. I had a case, I think I've discussed this case. It was a case of chronic kidney disease where the creatinine count was 4.1, and the patient's son used to come to me and say, my father, Dr. Saab, has become totally black. I thought maybe because of cigarette. He said, oh, maybe because of kidney. He said, no sir, not because of kidney. He likes the sun very much. In the morning 7:30 he sits in the, we say outside, the steps of this house, in the scorching heat of the sun. He feels absolutely fine. He does not open the cooler also. He does not open cooler also, and he sits, and he does not drink water also, but he is very happy in the sun. When the sun sets, he becomes very irritable. And I was surprised. My God, I had never seen that case in my practice. Without asking him more, I just wanted to give the remedy, because that remedy I had learned in my college days also, and now also. The remedy was strontium carb. I gave strontium carb 30 and then 200. You won't believe, the creatine count came down to 1.5 within 3 months. In 3 months, the creatine count was 1.5. Just with one symptom, the patient is better by heat of the sun. Are you with me, everyone? Are you with me? Yeah, so treat extraction and RTC would be same, Dr. Prasad. You can get the same, you can give the same remedies which I have told you. So strontium carb. Now every time strontium carb would not heal. So you must know for one symptom at least 3 remedies, so that you have an option to give each remedy symptomatically if it is changed. So think about strontium carb, think about thuja, and think about platina. All these 3 remedies have better or sun ameliorates the complaints. One more remedy you can add, that is, I think, stramonium. Are you with me? So think about strontium carb, thuja, stramonium, and platina. These remedies are exactly opposite to what we see in today's practice. We have aggravation, sun. These remedies are better by sun. Are you with me? Are you understanding? This is something very, very important to understand. Because common remedies, common symptoms are very. If I ask you, which are the remedies which are aggravated by sun? Okay, you can write down and then we'll discuss those remedies. So I'll take one question, sir. What are the remedies patient passes gas loudly before stools? Okay. Now, this is such a, such a fantastic. I would not say a fantastic question, but when we have these type of complaints, the patient says, passes flatters loudly, and I had, I had these type of complaints. Now, if you have these type of complaints, I have had 2 experiences of 2 remedies which I found very, very useful in my practice. First was argentum nitricum, and second was natrum sulph, and the third was causticum. These 3 remedies have given me very, very good results in my practice. Especially argentum nitricum, patient will come and tell you, sir, whenever I eat sweets, whenever I eat sugar, I get this type of symptoms. So you can have, this type of loud gases passing. You can have one group of remedies. Loud gas passing during stools, you will get a lot of remedies. And I had cases where the patient comes and tells me that loud gas passes after stools, and the patient was surprised, sir. I am so surprised, after before stool, during stool, every gas has passed, but I have a problem. I pass lot of loud flatters after stools. This is very, very important. This is very, very characteristics. And the remedy also is very, very sporadically used in practice, because normally you think about China, Lycopodium, Carbovage and argentum nitricum and lacasis and these remedies. But 2 remedies are very, very important in this type of complaints, where the patient says the patient passes flattest loudly after stools. Think about allosocretina and think about oxalic acid. Are you with me? Think about allosocretina and think about oxalic acid. Did you understand the answer? Try to first understand the answer, and you can always ask me more. In the meanwhile, I'll take one more question. Sir, gout pain hota hai 10 years se, joint and muscle pain. Oh my God. So see, you are complaining of gout pain for 10 years. First of all, what were you doing for 10 years? That's very important. Please don't take so much allopathy painkillers, because it will definitely hamper your kidney. So whenever you suffer from gout, gout is definitely treatable and curable also, my dear friend. So there are specific remedies for gout which normally you should get results. And the first remedy that everybody thinks about for gout, first 2-3 remedies. First is colchicum, second is benzoic acid, third is lycopodium, fourth is Artica urens. Now these remedies are very commonly indicated. I am sure for 10 years you must have tried and used this remedy. But there are some, sporadically indicated where you must think about these remedies in gout. And the first remedy, the patient comes and tells you that he is getting no relief with the so-called specific medicines. You can think about simple remedy, calcarea carb first. Think about the patient comes and tell you the patient that the pain is so severe, so I get a lot of perspiration because of pain and I'm drenched with perspiration. When the patient comes to you in the chamber also, he is drenched. Think about Muxol, my dear friend. The patient says, because of gout I have taken so much medicine, I have got a lot of constipation. Think about Nux vomica. The patient of gout, and another very infrequent indicated medicines, Soranum and Ledampal. So apart from the 4-5 remedies which are very specifically indicated for gout, these are the 4-5 remedies which are very sporadically used. You must think about these remedies. I had a case where, I'll tell you my failure also. I had a case where I had used, so many medicines. The patient was only better till I gave the medicine, otherwise the patient was not better. And whenever he did not take my medicine, the pain was so unbearable, intolerable, he could not bear the pain, so he used to take painkillers. Just with this one symptom, where the pain in the joints is always intolerable, cannot bear the pain, I gave a remedy, Manganum metallicum. Are you with me? Manganum metallicum. Okay, so these basically are the remedies you should think about. And of course, whenever a patient of gout comes and tells you that because of gout my urine has become very much thick, think about Artica urens. Whenever the patient of gout comes and tells you, sir, whenever there is gouty pain, whenever there is change of weather, my gout pain increases, think about Bryonia alba. So this is basically, you must think about these type of remedies. Of course, 10 years is a very long duration, my dear friend. Please treat yourself and heal yourself early, because I had cases where the patient had gout since 5-6 years, suppressed with allopathy, whatever medicines, and then he had complaints in the heart. So he came to me for heart complaint. I did not think about the suppression of gout, but nothing was working. So I asked him, what treatment did you take? And the patient said, I had taken a lot of painkillers for gout. He had taken homeopathy also. So I just took one rubric, gout metastasis to heart. Are you with me? Gout metastasis to heart, and I gave the patient Calmia latifolia, and Calmia latifolia treated that case. Are you with me? Are you with me? Did you understand why you have to treat such type of cases? Otherwise, if it metastasizes to other organ, then there is a problem. Did you understand, my dear friend, my dear doctor? So think about these type of remedies and these type of suppression in homeopathy. It could be suppression with homeopathy medicines also, my dear friend. Okay? Yes, okay. Sir, what is the specific medicines for burning of soles in evening ameliorated by washing the feet? Now, first of all, if you ask me this question, whenever you feel that you have taken a lot of pains in understanding the remedy, you have taken a lot of pains in understanding the symptoms of the patient, but still you are not getting results, please start with sulfur simple remedy. Please start with sulfurs in LM potency. It would give wonderful results. But sometimes, we are very fearful to give sulfur, because when you repetize the case, sulfur will always come. And if you look, okay, sulfur will think of health because it's a common symptom in sulfur, and how will sulfur work? But it definitely works, my dear friends. So if you feel that it is very common, don't think it is common. Sulfur works beautifully. Second remedy you must think about is calcarea carb. Calcarea carb, because in your case, it is better by washing the feet. Then you can ask by hot or cold water also. Third, think about lycopodium. Very, very important. The patient gets up in the morning and says, Doctor, there is so much burning in the soles. Think about phosphoric acid. Think about carbo veg. Think about Cocculus indicus. Think about lacasis. These are the remedies. Okay. So I thank you for being with me, and it's already half an hour up, and I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you for until next Thursday for our Instagram live. Thank you so much, and bye.